The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Simon Abraham, a cardiothoracic surgeon with Altman Medical Group. Good morning, Dr. Abraham, and welcome to the show.
Thank you, Paul. It's great to be here.
According to the Centers for Disease Control and Prevention, approximately 2% of people younger than 65 years of age have AFib, while about 9% of people ages 65 and older have it. AFib is the most common irregular heartbeat that can lead to various heart-related complications such as blood clots, stroke, and heart failure. This morning we're going to talk with Dr. Abraham about AFib, heart valve replacement, and other cardiac issues. We'd like to remind our listeners that you can listen to our radio show and just look for Health Matters in the App Store of your favorite smartphone, and you can take our podcast with you anywhere you go. If you have questions today, you can post them up on our live Facebook feed, and we'll address them there.
So, Doctor, tell us a little bit about yourself.
First thing to know is I'm not a native of Stark County. I've been in Canton and the Stark County area for a little bit over a year. I came here as a temporary or locum tenens physician in late 2018 and loved the area and loved my job at Altman so much, and I think they liked me, so we decided to stick around and make it a permanent gig.
Now, you said you were licensed in 3 states. Is that right?
Yes.
They are?
Ohio, Indiana, and Iowa.
Iowa. Your medical training?
Right. I went to medical school in Chicago, University of Chicago, and then did my surgical training at Johns Hopkins. I took a couple of years off to do research at the NIH, or National Institutes of Health, which were close by. And then I went to Ann Arbor in Michigan for a couple of years to do cardiac surgery training, and I also had an interest in heart surgery for children, so I spent a year at the Children's Hospital of Philadelphia.
Interesting.
And actually, a good part of my career was also doing children as well as adults.
Amazing. So what exactly is your function at Altman?
So I am one of the group of 4 cardiothoracic surgeons. My partner, who was here a few weeks ago, Dr. D'Agostino, focuses more on lungs and other non-cardiac issues, though he also does heart surgery. And the other 3 surgeons, myself included, focus primarily on diseases of the heart and the blood vessels within the chest.
And obviously you operate, you're a surgeon.
I'm a surgeon, yes.
It's always been curious to me about the minimally invasive surgery that's come about in the last few years, as opposed to literally tearing open the chest. And
Hopefully we don't tear open the chest, Paul. We try and my patients say that. I always like to say we open the chest, but very carefully.
That's what that's what all the heart people say. They say, "Oh, that tore open my chest," and "Oh my gosh, it hurts," and all that sort of thing. So it's kind of amazing to hear their side. When they come rolling into the store. So you came to Stark County. Why'd you come here?
Well, initially, I came because of the job. I had been in Toledo for a period of time, and I got a call saying that they needed a temporary physician, a so-called locum tenens physician, to come to Canton. And I had never been to Canton before, and I said, well, it's Hall of Fame.
Sure.
Let's go check it out. So I came. I was actually staying at a hotel along 77 for the first 3 or 4 weeks that I was here. And, when I got to Altman, it just seemed like a very natural fit as far as the people that I work with, the cardiologists, and the overall hospital. I think the quality of care, the support that we have as physicians are excellent. And I really enjoyed the patient population here. And they seemed to like me, so it was kind of a natural thing.
Our pharmacy has been in front of Altman for 45 years. And when we first opened, there were all kinds of houses around us. And, the hospital, the medical building that sits out front wasn't even there. And that road, actually Clarendon, which goes down to the emergency room, actually went through to 6th Street. So there's really been a million changes in the structure of the building and, all the things around it. So I wish I had some early pictures. I just never took any. So
there may be some in the lobby. I don't know. I mean, I certainly only first got to Altman maybe 15 months ago. But, Altman is constantly changing and growing and expanding its footprint in Stark County. So I think that's a great thing.
Do you treat patients of all ages? Or
currently, I treat adult patients. I'm certainly comfortable doing older children or young adults, having spent a lot of my career doing that. But most of our focus really is adult patients that would be, 50 and older, just given, the population that is most affected by heart disease in this country.
Where would the young children be treated for heart issues? Children's in Akron, or?
Well, in Stark County, they can. They really have a variety of places. Children's in Akron would be obviously one. If people wanted to travel further, they could go to Cleveland or Columbus, which also have good children's hospitals.
Okay.
All right, well, let's talk about AFib. We hear a lot about this in the pharmacies, and people come in and say, oh, my gosh, I just got diagnosed with AFib, and they're really scared. Can you talk a little bit about what it is and really who can be affected? Is there a person that maybe is more predisposed?
Sure. So let's talk about a normal heart rhythm to start. The heart has a very nice electrical system that coordinates the heartbeat, which starts with the upper chambers contracting first before the lower chambers or ventricles do. And it's only a split-second difference, but it makes a difference in terms of cardiac function and overall health. What happens is that as you get older, more and more patients have irregularities of that atrial heartbeat. And the A in AFib is for atrial. So instead of having a coordinated heartbeat, the upper chambers of the heart can start beating irregularly. People, when you actually look at it in an open chest, a patient with AFib, it almost looks like a bag of worms. It's not a nice coordinated heartbeat. It's very irregular. And some patients can feel it immediately. Others don't even know that they have it. The importance of AFib is that without a nice coordinated heartbeat, that can lead, one, to heart failure, and two, it can lead to blood clots forming within the upper chambers of the heart. And those, if they ever break off and leave the heart, can lead to strokes and other problems. This is predominantly a problem that becomes more manifest as you get older. So under 40, it's rather rare. But between 40 and 65, the incidence is a little bit over 2%. And then it starts to rise over 65. And once you're in your 80s, as you mentioned previously, you get to nearly a 10% incidence. And that coordinated contraction between the upper and lower chambers really helps with cardiac output, and then obviously, increases the risk of stroke and other problems.
Is there any relation between an AFib and a murmur?
There can be. Indeed, certain valve problems predispose patients to AFib, such as a mitral valve problem, which stretches the upper chambers of the heart, and that stretching can lead to an increased incidence of AFib as well. So,
you listen to Health Matters with the Medicine Center Pharmacy.
You can get more information right now by visiting MedShopRx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Visit Studio Arts and Glass and shop for your Valentine. We're featuring unique jewelry handmade by American artists, sterling silver, semi-precious, and precious stones. Also, make sure to check out our selection of fabulous gifts created by local artists. Our friendly staff will be happy to assist in choosing and wrapping the perfect gift for your Valentine because she's worth it. Open Monday through Saturday at 9 a.m. on 77 and Apple Grove in North Canton.
Welcome back to Health Matters with the Medicine Center Pharmacy. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Simon Abraham, a cardiothoracic surgeon with Altman Medical Group.
Well, since it's February, heart topics are good topics, so we are talking about AFib before our first commercial break. So if you're just tuning in, we're going to talk about AFib and how it's treated. So, Doctor, could you share with us treatment options for AFib?
If you're first diagnosed with AFib, the immediate treatment is, one, make sure that the heart rate is controlled. And then if you see a cardiologist, for instance, they're going to try and convert you back to a normal rhythm. There are a couple of ways to do that. One would be with medication, and the other option is with electricity or electroshock, what would be called cardioversion. Now, that is not as exciting as you might imagine from watching TV shows, but you know, if your doctor decides to do a cardioversion on you, you'd be brought into the hospital. You'd have some brief sedation, so you would be out for the few seconds or minutes while they shock you, and hopefully at the end of that session you would go back into a normal heart rhythm. There's certainly the possibility you could go back into AFib again, but most of the time they're going to load you with some medications before the shock to try and keep you in a normal rhythm afterwards.
So I never knew that was a common treatment. I mean, I realized in the emergency situation, but I never realized that was a treatment.
It certainly is, and if you go to any hospital in the cardiology department, you'll see patients all the time being brought in for cardioversion.
Success rate?
A long-term success rate for all treatments is probably around 60%. Now, it really depends on whether you have what's known as paroxysmal AFib, where you have brief runs or bursts of AFib. That is a little easier to treat with a higher success rate, to chronic, almost permanent AFib, which is much harder to treat. And certainly the cardioversion and the medicines are one spectrum, least invasive way of doing this. If, for instance, you continue to have problems with AFib, depending on your cardiologist and your electrophysiologist or EP doctor, they may want to consider you for something known as ablation, in which they run some special tubes and wires up through your groin into your heart, and then using different types of energy, either what's known as cryoablation or radiofrequency ablation, they can try and get you back into a normal rhythm.
You know, I've been a pharmacist for a long time, and I come from the era when they had Digitalis, Cristadigin, Lenoxin, and that was it. You know, there wasn't really much else to.
I remember those days. Digoxin still has a place, but it's probably less than it used to, with a whole bunch of new medications such as Coderone and flecainide and other drugs. But Dig helps to control the heart rate, and it used to be 25 years ago. You would put somebody on Dig to control their heart rate, and then usually Coumadin or warfarin as a blood thinner to reduce the chance of stroke. Wow. Today, our armamentarium is much wider, and it's always good if the earlier you can get to a patient like this to start the treatment to prevent them from being in this sort of permanent or chronic AFib, which is harder to correct. And in those cases, obviously, sometimes just putting them on an anticoagulant. Now, we have new anticoagulants. You don't just have to be on Coumadin or warfarin. There are, the 2 or 3 newer ones that you can use as well.
Well, what about heart transplants? 25, 30 years ago, this guy in South Africa, Christian Barnard, the doctor, did the first transplant. I guess it was quite miserable for the patient, but I never hear of heart transplants.
You probably don't hear about it anymore because it's become much more routine.
I see.
There are over 1,000 heart transplants done within the U.S. Every year.
Wow.
Probably a couple of thousand. The limitation today in terms of transplantation is the number of donors that are available.
Sure.
And it has become a fairly routine operation.
Interesting.
So today is Go Red for Women's Heart Health. Are women more likely to be affected by heart disease than men?
Well, that's an interesting question. Up to probably menopause, women are somewhat less likely to be affected than men. It seems that that is somewhat protective, especially against coronary artery disease, compared to men. But then once women go through menopause, within 5 to 10 years after that, they seem to catch up with men in terms of the incidence of atherosclerosis and coronary artery disease.
What about some other statistics regarding heart disease? Do you have any? I guess our listeners always wonder, am I at risk? If you don't have an issue and you're listening to a show like this and you think, oh my gosh, as I get older, I'm more prone to getting AFib. But even your 10% number you mentioned earlier in your 80s doesn't sound too ominous, but that's a lot of people. So
it's a lot of people because coronary artery disease and heart disease is so prevalent within the United States. And really, we used to say within the United States and Western world, but now, as the standard of living rises throughout the world, you're seeing a huge amount of heart disease, even in developing countries like China and India. So I don't know exactly what it is. It may be that, that as we get older, some of this is just, a natural progression of disease that we probably wouldn't have seen if we had been dying at 50.
Well, I was thinking about Kirk Douglas, since he lived at the healthy age of 103, and it does make you wonder, how do we have more problems because we're just living longer, or we have better medicine and technology, but therefore we have more complications as time goes on. So
I think what you're seeing is as medicine gets better or more advanced, we're dealing more with acute problems that may have arisen early on, especially infections. Those, by and large, have been taken care of, and now we're dealing more with chronic problems that come with aging. So, the increasing incidence of heart disease and cancer and things like that tend to happen to people who are older. So, and as the population ages, we're seeing more of that.
Yeah. Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting MedShopRx.com. That's MedShopRx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at MedShopRx.com for the pharmacy nearest you. That's MedShopRx.com.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Lots of new merchandise at the Half Off and Hot Buy store in Louisville. 2 new pharmacy inventories, lots of vitamins, cough and cold, at half off regular retail. We have all the Valentine's Day decor out and candy, and also Easter's coming in. We are setting up new spring merchandise already. Also a large order of everyday home cleaning supplies and kitchenware. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Don't forget, you can still get your flu shot at the Medicine Center Pharmacies.
Hey, it's Jim Michaels. If you have an Alexa, all you have to do is say, "Hey, Alexa, play 1480 WHBC."
Just ask Alexa.
Hey, Alexa, play 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing AFib and heart valve replacement with Dr. Abraham from Altman Medical Group. We've got a lot more to cover this morning, so let's get back to the show.
All right, during the break, we had a caller, and she had a question about the Watchman procedure. Can you address that and let our listeners know what that is and who it can be helpful for?
Great. So the Watchman procedure is indeed for patients with atrial fibrillation. So as we discussed earlier in the hour, patients with atrial fibrillation are at risk for having strokes and other embolic events, meaning having blood clots break off from inside the heart and be ejected out into the bloodstream, where it can really go anywhere within the body. The area from which has the most common site for blood clot formation is called the left atrial appendage, which is a little windsock type protrusion from the left atrium, and it's a little pocket that just sits there. It's probably like the appendix in your belly. There's probably no good reason for it to be there, but it does collect blood. And when you're in atrial fibrillation, that blood can become static within there and clot off. So one way to deal with that, obviously, is with blood thinners, as we've discussed. If you continue to have problems, you can have what's known as a Watchman procedure, which is relatively new within the last 5 years or so. And that really basically puts a little plug in that area. It's done like a heart cath, where they pass this through your groin, up through the heart, and then place this little plug-type device to cover up that appendix and prevent any blood from either leaving or getting in to the atrial appendage. So that's what's known as the Watchman procedure. You could come in, have it done, usually can go home, but usually by the next day.
Well, amazing. Just amazing. So how about some of the latest developments in heart?
Well, Watchman is one. There are other interesting and new devices that have been developed over the last 10 years or so. The most prominent one is something for the aortic valve. As patients get older, some of them develop murmurs. And, one of the more common murmurs that you can have is from something known as aortic stenosis. The aortic valve is the valve that opens and closes when your heart squeezes, and it allows blood to eject out of the left ventricle. In certainly a fair number of patients, as they get older, that valve can narrow, causing the heart to work harder. If you think about it, as it starts to narrow, the heart has to work harder and harder. It's kind of like weightlifting for the heart, is what I tell my patients, because the heart has to squeeze even harder to get through a narrow hole. Weightlifting might be good for your biceps, but it's not good for the heart because it makes the heart thicker, it makes it stiffer, and as it gets thicker, it requires more coronary blood flow. And what usually happens in this day and age is that as this aortic stenosis gets worse and worse, and by the way, it never gets better, it only gets worse, you begin to have symptoms. And so what are the symptoms? You might start to have shortness of breath. You might start to have exercise intolerance or fatigue. And certainly in older patients, it's you often, when you're talking to them, you have to kind of tease this out. One of the questions I always ask patients is, are you taking more naps than you used to? And it's surprising, patients who say, I'm perfectly fine, doc, I don't have any problems. You start to ask them, are you taking more naps than you did 2 or 3 years ago? I say, hey, you're right. Yeah, I'm taking more naps. So once this aortic stenosis becomes severe, you need to do something about it. And this new technique is a placement of an aortic valve without open heart surgery. Okay, and the acronym is TAVR for transcatheter aortic valve replacement. And the studies that have been done both in the U.S. and in Europe suggest that TAVR is an excellent substitute for open heart surgery, certainly for high and moderate risk patients. And lower risk patients, I'm not sure that the evidence is quite clear which one is better. But certainly for patients that previously might not have had anything done because they were 85 and frail, can now have a TAVR procedure done where their aortic valve is essentially replaced. You can come in the morning, have it done, and potentially leave by the next day.
Gosh, let's jump back to weightlifting for a second. All right, we have young children, 13, 14, 15, in athletic programs lifting weights. What's their future look like?
In terms of heart disease?
Yeah. And you're talking about the weightlifting and the adults, and I forget exactly what you said about the heart in that scenario, but what's with the young kids,
Yeah, so what I was referring to in aortic stenosis is that's like weightlifting for the heart, meaning that as the heart has to work harder constantly because of this narrowed valve, that is not good for it. I think for young people who are involved in athletics, I think weightlifting is okay as long as their hearts are normal. Okay, and it's very hard to imagine telling a 14 or 15-year-old, and I'm thinking back to when I was that age, that I'm not going to lift weights.
Yeah. Well, it just seems like the young folks are under a lot of pressure to perform in athletics, and it seems like they got these 13, 14-year-olds doing things that I would never have imagined, they have them do.
Yeah, sports have gotten a lot more competitive than they used to be, at least. I was never a great athlete, but I was always interested in it.
Yeah.
But compared to today's kids, I think this is out of my range of expertise, but certainly parents are under a lot of pressure, or put the kids under a lot of pressure to perform.
Well, we had when I was in high school, we had 3 or 4 sports. Now they got everything from lacrosse to, I don't even know what else they're doing, but all the girls are all in it, and as well as the men. Which, in my growing up period in high school, there were very few girl sports, women's sports. But there's a heck of a lot of it going on now. So.
I think part of it is a lot of these new metrics and things that start with the NFL and the NBA and the major leagues kind of all start to filter down to the college and then the high school level. I was at a dinner about a week ago where there were a couple of parents who had very competitive, high school baseball pitchers, and the, amount of computer stuff and cameras and things that they used just amazed me. It wasn't just a kid going out and throwing the ball anymore. It's pretty serious stuff.
Interesting.
So why don't we talk about heart valves? You touched on it a little bit. It seems like there's been a lot of advancements in replacing heart valves now.
Well, one of the things we talked about was the TAVR procedure, which has been really revolutionary in treatment of aortic stenosis. Okay. The other things that have not quite as revolutionary, if you will, is the mitral valve is another valve in the heart. Those two are the most commonly repaired ones, are the aortic valve and the mitral valve. We are repairing a lot of mitral valves now instead of replacing them for the right situations, and we've become better and better at doing that. And for certain types of mitral valve disease, we can tell a patient, hey, there's a 95 to 100% chance you can keep your valve rather than replacing it. Now, if we have to replace it, there's a couple of different scenarios depending on the age of the patient and lifestyle choices. People talk about pig valves and they talk about metal valves as a general. They're not really metal, but
and you don't take the old valve out. Is that correct?
For which one?
Well, for any of those valve replacement surgeries. Well,
if you're doing a TAVR, meaning you're putting the valve up through the groin for the aortic valve, you don't actually take the valve out. Okay. If you're doing open surgery, you might and often do take the old valve out, because when you look at it, it's become like a rock really inside. Sure. It's full of calcium and needs to be debrided and to put a new valve in. But to get back to this, pig valve versus metal valve, the what's known as pig or bioprosthetic valves, the nice thing about those are you don't need to have any long-term blood thinners for those valves.
Why is that? I mean,
because they're made of biologic material, so they don't tend to have clot, form on them. Unlike the mechanical valves, which need to be on blood thinners for a lifetime.
So the pig valve is more like the human than any other animal valve?
Well, I just use pig valve as kind of a generic term because some of them are indeed made of material from pigs. Others are made from material from cows. So you can imagine I've had a couple of farmers who feel very strongly one way or another depending on what they raise.
Okay, I would never thought that, but okay.
But I think the important thing here is that if you're getting a bioprosthetic, a pig or a cow, you don't need to be, at least long-term, on blood thinners. Whereas if you're getting a mechanical valve, you do need to be on blood thinners.
Interesting, and they're not rejected.
Correct. They're not rejected.
Oh, interesting.
Okay, they're treated specifically for that. Now, what happens in those, though, is that the pig and the cow valves or bioprosthetic valves do deteriorate over time. So the younger you are, the faster they deteriorate. So
you could expect to have a couple operations in that area over your lifetime, or more?
Potentially. Let's say you're, the tough one is the 45 or 50-year-old guy or woman who needs to have their valve replaced. What's the right solution? Do you want a pig valve put in, not be on any blood thinners, but know that you might have to come back in 10 years for another operation? Or do you want a mechanical valve, but you got to be on blood thinners?
10 years later, you might not be physically able to go through the surgery.
Sometimes,
I suppose that's an issue.
Yeah, I had a lady who was insistent on pig valves, and the morning of surgery, she said, "I don't ever want to go through this again. Give me a mechanic." So
you had to run out and get one. Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Visit Studio Arts and Glass and shop for your Valentine. We're featuring unique jewelry handmade by American artists, sterling silver, semi-precious, and precious stones. Also, make sure to check out our selection of fabulous gifts created by local artists. Our friendly staff will be happy to assist in choosing and wrapping the perfect gift for your Valentine because she's worth it. Open Monday through Saturday at 9 a.m. on 77 and Apple Grove in North Canton.
Lots of new merchandise at the Half Off and Hot Buy store in Louisville. 2 new pharmacy inventories, lots of vitamins, cough and cold, at half off regular retail. We have all the Valentine's Day decor out and candy, and also Easter's coming in. We are setting up new spring merchandise already. Also a large order of everyday home cleaning supplies and kitchenware. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Don't forget, you can still get your flu shot at the Medicine Center Pharmacies.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us this morning, and let's get back and talk to the doctor.
So let's talk about heart bypass surgery. It's a pretty common procedure. How is the procedure performed, and why would you use this procedure rather than using stents?
That's a good question. So I would say that 50 to 60% of our open heart surgical volume is heart bypass or CABG, coronary artery bypass grafting, because it's a very coronary artery disease is quite common, and we have patients coming in either with angina or chest pain, or sometimes after a heart attack needing to have bypasses. So we have in our body two major coronary artery systems, the left and the right. It's very simple, and they can at various places get blockages. The human body has a lot of extra capacity, so that in most cases a 50% blockage does not cause angina. But once you start to get to 70% and more, it can potentially cause problems. If you have a single blockage, or if you're extremely high risk, a stent may be the way to go. And certainly the cardiologists, our cardiology colleagues, are very good at putting those in. And frankly, patients would prefer a stent to open surgery. But if you have multiple blockages and or you're diabetic, and in certain other situations, you would in the long term be better off with surgery. And that's been pretty well shown by multiple studies. So what does a bypass do? Well, using different arteries or veins from within your leg, we can bypass, get blood past those areas of blockage to your coronary arteries, so that your heart muscle, which is the important thing, is getting adequate blood supply, and that improves lifestyle because it prevents chest pain, and in certain situations has a very good effect on your lifespan mortality as well.
We had a physician on the show some time ago who said basically that a stent is just a quick patch, and that you should consider bypass, whatever. Okay.
Was he a surgeon?
Actually, I don't recall. It's been quite a while, because I was kind of surprised to hear that come out of it. I mean, there's so many stents being put in everywhere anymore.
Well, I think stenting has undergone an evolution. You know, when it first came out, it was the shiny new thing for cardiologists, and there were a lot of stents put in. And like any new technology, as the evidence accrued, it didn't seem quite so shiny anymore. There's no doubt that coronary artery stents are a huge advance in the treatment of heart disease. It's just with more experience, we've learned, there are certain situations where stents work really well, and there are certain situations where they don't work as well.
Now you can get through the groin, through the arm, through whatever else these days to put a stent in.
Correct. You can do it through the groin, and you can also do it through the wrist nowadays.
No kidding. Wow.
Yeah. So,
it's amazing.
All right. Well, we're running tight on time. Any exciting things coming up at Altman Heart Center that you'd like to share with our listeners before we wrap up?
Well, we're doing more minimally invasive surgery at Altman than we used to. And I think the other exciting thing is we are getting much better at cardiac imaging, as one of our cardiologists has now become trained and started to do both cardiac MRI and cardiac CT. And I think
see more.
When you can see more, you have more accurate ability to diagnose. And some of these tests are also rather functional, meaning you can tell where the blood is going and where it's not. And all of that information is really can be critical to the proper diagnosis and treatment of patients with heart disease.
Thanks to our special guest, Dr. Simon Abraham, cardiothoracic surgeon at Altman Medical Group.
HeartCore, yes.
HeartCore, okay. We'd like to remind our listeners that if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
I can't eat another bite.
Hey, local restaurant owner, want to see some new faces? Join the family of WHBC's meal deals, but hurry because they're going fast.
News Talk 1480 WHBC.
WHBC.com.